Deep Singh sir, I remember still our interactions when you were here in 2019 and Dr. Pradeep's. And it's a very memorable event for all of us coming together and discussing. And of course, we have shared a lot of experiences at that time, and we are continuing the same journey. I'm very happy that today we are able to again meet and discuss. And I think as Dr. Pradeep and myself were discussing, I think we should continue this journey for another maybe till we feel that we are working together and can do something good for the reaching the unreached people. That's what Pradeep also was telling. So we will work together in future. Maybe I would request both of you to initiate a MOU, Memorandum of Understanding. If you have no objection, I will send a draft to you so that we can work together wherever it is, of course, whatever it is possible. In a small way, we can start our activities coming together and working together.
Yes.
I actually still remember your interactions. I am very happy, glad, and grateful to the management of AIIMS Jodhpur and the students and the other faculty working for this tribal project on behalf of the Pravara Institute of Medical Sciences. Uh, uh, of course, we have been in this field not only because we are right in the rural area. So by default, we have been working with the community since the inception of our institute. So I think, can I start my presentation? Thank you very much for inviting me.
Of course.
Yeah.
Yes, please.
Good morning to all the viewers, faculty, and students of All India Institute of Medical Sciences, Jodhpur. I once again thanks the organizers of this event for in giving me an opportunity to share our experiences in the community engagement activities. My today's presentation would more focus on the community-oriented medical and health professional education. This is what we have been imparting for last almost 40 years since our inception of our college. So, and some of the experiences and some of the enabling environment that we have created in the community for implementing this pedagogy of community-oriented medical education. Yeah. Our university is a part of a integrated rural development model, and it was established by a non-governmental organization called Pravara Medical Trust. It was almost established in 1972, and it is a part of a overall multi-sectoral developmental model. The model is, of course, today called as a Pura model, that is provision of urban amenities in rural area, coined by Dr. APJ Abdul Kalam, who visited us in 2005. So this is what we are trying to create, urban facilities in the remote rural area. We are located in a very remote rural area, and we are trying to develop the quality of life of the local people through various developmental activities, including agro-based industries, we have a cooperative banking, we have educational institutes. In this remote village, almost 40,000 students are pursuing their education from KG to PG and PhD in all faculties. And we are, of course, primarily focusing on healthcare. The Pravara Medical Trust is primarily focusing on healthcare, primary to secondary, and we are also have different institutions which are focusing on social developmental activities, agriculture and irrigation and livestock. So this is a for a overall development of the rural and tribal people. So this is a model that is created. So our the parent organization, Pravara Medical Trust, whose simple mission is only serving the rural poor and improving the quality of life of the rural poor. And the approach that we follow, it is an integrated, holistic, problem solving and community oriented in all academic institutions. So under the, we are of course recognized as a deemed university in 2003 under the name of Pravara Institute of Medical Sciences. And we have today 8 constituent units. We have the first academic institute started by the non-governmental organization Pravara Medical Trust was a rural medical college in 1984. So today we admit about 200 MBBS students and the same number of postgraduate students in different clinical, paraclinical, and preclinical subjects. And we also have, after many College of Nursing in 1986, we have a rural dental college, we have a College of Physiotherapy and Rehabilitation Center, we have a School of Public Health and Social Medicine, we have a Center for Biotechnology, we have College of Ayurveda. We have actually 2 colleges of Ayurveda. One was established in 2005, about 100 kilometers away from here. But in 2022, recently, we have established another second college of Ayurveda in the same campus, where all the healthcare and medical education institutions are located in this village. And the recent college is College of Pharmaceutical Sciences that we have. These 8 institutions are located in this village, which is about 290 kilometers away from Bombay, a remote rural area, and it is about 150-acre campus. In that campus, all the institutions are located and all the faculty and students live in the same campus because it's a village. There is nothing much outside where the people can, of course, have a quality of life. So we have created a township in this 150 acres of campus. And our institutional social responsibility is the education, training, research and services and community development. And what we feel that this should lead to more just, equitable and humane and sustainable society. So the whole philosophy of our education and research, because what I am going to talk, what all programs that we have and the research activities that we do is all mostly related to the community development, community empowerment, and the rural development and the area development. So this is the focus of our all undergraduate, postgraduate programs, and also the research PhD students. And we have about, because as I said, this campus, this Pravara Institute of Medical Sciences is focusing only on the medical and health sciences education. So we have about 4,000 students on campus from various faculties, faculty of medicine, dentistry, nursing, and other allied health sciences faculty. And we have about, in the same campus, almost all the faculty and staff and their families, because we have about 15,000 members in the same campus, whom we provide as a community our services, and about 1 million per year. We from OPD and IPD we see the patients, and we also, because it's a rural area, when our patients are admitted, as we all know, our family structure and family systems, that lot of relatives come in and try to support the patients here. So we almost cater to 1 million per year, even relatives of the patients, and even their food and everything. Community health volunteers we have more than 1,000 community health volunteers. We call them female health volunteers in the villages, and we have about neighborhood community whom we serve through our activities are almost 6,50,000 people in about 250 to 300 villages that we have. This is the area where we are located. It is in the Ahmednagar district of Maharashtra, which is away from about 290 kilometers from Bombay, and about 170 kilometers from Pune, which is the nearest city. Uh, and this is the area we cover about the target community for all our community engagement and social responsibility activities are rural, tribal, and we also serve some urban slums in Ahmednagar district, and also Nasik district, which is a neighboring district. And Nasik district is also a highly, of course, tribal population. Almost out of 50% of their talukas are tribal talukas. So this is our target area of the community. We work in almost 200 and more than 235 villages, of which 100 are tribal villages. So this is the overall area where we focus our both academic research and services of our area. And the focus target community is farmers mainly, because this is a rural area where small and marginal farmers and the farm labor and women and children, adolescents and elderly population. And we also work for the school going and school dropout, migrant workers, because this is a sugarcane growing area, and we have the first of Asia's cooperative sugar factory. That is our parent organization of this university, which was established in 1949 by the uh, local farmers only. They came together and started the first in Asia, the cooperative sugar factory. So lot of migrant sugarcane harvest workers come to this area. So we serve all those migrant workers and also industrial workers, and also the other socially neglected communities like female sex workers, LGBT, and other people living with HIV/AIDS and all. So in order to serve all this community and the area which I have already described, we have created an institutional mechanism to implement our pedagogy of community oriented medical and health professional education. Uh, the School of Public Health and Social Medicine, which was established in 2001, which was initially part of a community medicine department of the medical college. The medical college was established in 1984, as I said. Since the first batch of our medical students, we adopted this community oriented medical education. So community medicine department of the medical school has been implementing this pedagogy of community-oriented medical education to the medical students, so that the medical students who are admitted from all over the country, they are exposed to the rural and tribal communities in this area. So we have adopted a curriculum, inbuilt curriculum for that. So that same thing, we have been following it up. Our own learning was that we had to reach many more communities and many more activities that we have to design to improve the quality of life of the people whom we are serving. So only the jurisdiction that is given to the community medicine department will not be sufficient to undertake all these activities. So we thought of establishing a separate center. So we established it in 2001, Center for Social Medicine, to create an enabling environment in the community, so that all our academic research and training and services can be provided through those infrastructure that we have created. So a separate center for social medicine, which recently the name is changed as a School of Public Health and Social Medicine. So this School of Public Health and Social Medicine has three centers apart from academic and research. So we have academic and research under the School of Public Health, which teaches masters in public health, masters in medical social work, and various other diploma and postgraduate diploma programs and all. But we also have three centers which focus mainly on the community oriented medical and health professional education, and they give a catalytic approach to all other constituent units. So the center for the first center is Center for Community Health and Development. We have another center for Tribal Health Research and Services. This is has been recognized by the uh, Ministry of Tribal Affairs as a center of excellence, which is located in a tribal area. And we also have a center for vocational and skill development training, which is mainly for providing all the Prime Minister's skill development programs and other skill development programs for the unemployed youth and school dropouts of the both rural and tribal areas. So these centers are providing all the services to all the constituent units. Naturally, the medical school still continues its all activities of the community through the community medicine department, all its community activities. Similarly, the dental school implements their community activities through the public health dentistry department. The physiotherapy school implements the community activity engagement activities through their community physiotherapy. Same public health nursing department of the nursing school. This is the School of Public Health and Social Medicine.
Social medicine strives to integrate health with other sectors for overall development through community-oriented medical education and research. The center trains public health professionals at global level and skill development programs at grassroots level. The center has been implementing comprehensive rural, tribal, and urban community health services and interventional research projects, which are supported by national and state health ministries, Pathfinder International, USA, IE3 Global Internship Program, USA, and Global Fund to Fight ATM, etc. The social medicine strives to
I think I just want this slide I can skip, because this is only emphasizes what are the advantages of a community and what is the approach of a community oriented medical education vis-a-vis institutional medical education. And now I will come to the main area, the what are the functional approach. how do we implement this community engagement activities through our teaching, research, and services? Uh, we have a village family adoption program for all undergraduate students. That means whenever an undergraduate batch is admitted in our colleges, we adopt a village or villages and allot 5 families to one student, and that student will follow up those 5 families for during their entire academic curriculum, academic program. Suppose an MBBS student is admitted in our medical school, and he gets 5 families from an adopted village, and he will follow it up those 5 families for 5.5 years, that is including internship. So this is how the village and family adoption program, and there is a detailed journal in which what to do in the first year, what to do in the second year, what to do in the third year, and in the internship. Everything is written so that the students are guided by the postgraduate students of the same department and also by the faculty of the same department. This is how the undergraduate program is integrated with the postgraduate program, and also the faculty develop faculty and community engagement program. So this is how it is integrated, faculty to postgraduates to undergraduate students. So this is one program which has been implemented for almost many years in almost all the adopted villages. The second is we have a special internships, electives for undergraduate students. Under the National Medical Commission's recent directions also, we have competency-based program. Under the competency-based program, we have given a special internships and electives for all the undergraduate students, not only in the government primary health centers, other thing, our own primary health centers, and I will explain you our own primary health centers and tribal health centers. And we also have specialist clinics on rotation basis by our postgraduate students at all our own rural and tribal health centers. So these specialist clinics are in rotation by all the clinical departments of our medical school and dental school and the College of Physiotherapy. They will conduct these specialist clinics. It is a every week, 2 days in a week, in a rotation. They cover all the health centers that we have. So uh, medical and allied subjects departments will go together. Similarly, the second week will be surgery and allied subjects will go. And third is gynec and obstetric and other departments will go like that. So the program is set and they will go in rotation. These postgraduate students cover all the 8 rural and tribal health centers that we have on a fortnightly basis, so that they will have to go to the same center on a fortnightly basis. This is how the uh, uh, specialist clinics are conducted at these rural and tribal health centers by the postgraduate student resident, both junior and senior residents of various clinical departments. But we also have mobile hospitals, mobile clinics, and also village level health clinics. I will come to these mobile and village level health clinics. So we have a program for our undergraduate and postgraduate students to visit and these mobile clinics and other village level health clinics. We also have a community level medical camps we conduct both in rural and urban. I mean, so rural and tribal areas. Once in 3 months, we go to the tribal community for conducting a multi-diagnostic camp. That means about all specialities of the medical school will go, medical and dental and physiotherapy. they will go and conduct these multi-diagnostic camps. Similarly, they also conduct a small specialty camps at these villages. So once a month, every one Sunday in a month, they conduct this multi-diagnostic camp either in a rural area or in a tribal area. So training at national, all the public health programs that we have and the projects, we have a number of PPP model projects, uh, public-private partnership. Under that public-private partnership, we implement a number of projects supported by the National AIDS Control Organization or MOTA, Ministry of Tribal Affairs, and RNTCP programs and all under this. So we these are all funded projects in the communities. So all our undergraduate and postgraduate students do take part in these. Just for example, suppose we are working for female sex workers or migrant workers under NACO. So we conduct sexually transmitted infection camps for STI and HIV detection. So these camps are conducted by our postgraduate students of the medicine and skin and VD department people, like that. So the residents and the project staff are involved in all these public health programs. Similarly, we conduct a lot of public health days, public health weeks, and other awareness programs. And all these programs, all our students are participating, not only at the institutional level, even at the community level. And we also have a WHO concept, World Health Organization's healthy setting concept, that is called health promoting school. So we have about 30 schools adopted by our university. In all those schools, we try and impart concept of health promoting school through school health, hygiene and environment program. We call it as a SHAPE program. And we also have a community radio station here, and all our postgraduate students do give health talks through this community FM radio station, which covers about 30 kilometers around this area. And we also have e-health programs through our telemedicine centers. They provide the health talks. All our PG students and the faculty provide health talks through this teleconferencing programs. And we also participate in all NSS and other government programs. This is how we implement our village adoption program, family adoption program. First year, what we do, first MBBS 1 year, every week, every Saturday, our MBBS students in the first year, they go to adopted village and they do their work under the guidance of a postgraduate student and a faculty. So this is how the chart is prepared. First year what they do, second year what they do, third year what they do, like that. So this is.
We are allotted 5 families each in our first year from an adopted village, and we continue to follow them for 5.5 years, including in our internship. We study various factors like socio-economic, cultural, environmental, and behavioral patterns in the context of rural health. We are allotted 5 families each in our first year.
Yeah, this is in order to implement the community-oriented medical and health professional education curriculum, we have created an infrastructure in the community. So we have adopted about 250 villages so far, of which, as I told already, 100 villages tribal and about 200 villages in the rural areas. So we have at the bottom, we implement the whole program through a 5-layer program, 5-layer approach. The bottom level, we have about more than 600 trained Arogya Mitra, we call it now community health workers, and they are empowered, they are trained, and of which even including the traditional birth attendants, traditional healers of the tribal area are also there, including the school teachers, of the ashram shala, that is ashram shala means the tribal schools, and also the female health volunteers at the bottom level. Then we have at the cluster level, we have a Gram Arogya Bank, and we have such 24 now. Of course, it's a old slide. Now we have 24 Gram Arogya banks. So these Gram Arogya banks are run by the certified Arogya Mitra with some additional equipment. Then we have mobile medical clinics, and we have rural and tribal health centers. Then on the top, we have our university hospital and services. So this is a both forward and backward linkages using this we are doing. So what healthcare services that we provide? We provide the tertiary level healthcare services through our 1,375 bed rural hospital. This is called a Pravara Rural Hospital, which is a teaching hospital attached to our medical school. And we also have a 350 chair dental hospital attached to our dental school. We have a world-class physiotherapy and rehabilitation center, which is attached to the physiotherapy college. We have a rural cancer center attached to the rural medical college. And also we have primary health services like primary health centers. We call them a rural and tribal health centers. We have mobile clinic, and we have a Ayurveda hospital. All these all these healthcare services, they go to the community and provide community services once a month through a multi-diagnostic camp, we call it. On the spot, we provide the services, and we refer almost 20 to 25% of the cases to the hospital and provide free treatment. Both at the OPD level, in the community, it is free. Registration and services are provided free. Even when they are referred to the hospital, tertiary level hospital, they are provided free treatment. And we also conduct specialty level camps like eye camp, MCH, STI, surgery, ortho. These are all specialty level camps. They are conducted twice a month in the community. So all are referred to the hospital and provided free treatment. So we have about 8 rural health centers and 2 tribal health centers. Overall 10 health centers that we have. Under the 10 primary health centers, 2 are operated by the medical school under the Department of Community Medicine as per the NMC regulations. One RHTC and 1 urban health center, we call them. The remaining 8 centers are run by the School of Public Health and Social Medicine. They are all well staffed. All the services are provided in these centers, well equipped, and including the specialist services are also provided in certain centers. In one tribal center, we have all the X-ray lab and neonatal labor room and everything. Specialist services are also provided in these. And also each rural and tribal health centers, they also have their own catchment area. So they also provide their community services, extension activities. So each medical officer is given a chart for providing the whole team provide extension services. So we have these centers are used for undergraduate training, postgraduate training, and even the other research activities. So this is the tribal campus that we have. It is located we are located in Ahmednagar district. In Ahmednagar district, only one taluka called Akole, which is notified by the Ministry of Tribal Affairs as a tribal taluka. So it is about 100 kilometers away from our university. So we established here a tribal campus of our university and provide all the academic and research and services through this tribal campus. So in this tribal campus, we have established a center for research in tribal health and services, under which we have a tribal healthcare division, we have a tribal research division, we have a skill development division, and a tribal museum, through which we provide a lot of services. And we have about 2 tribal health centers in that area, one in the same campus, tribal campus, and another tribal health center is about 20 kilometers away from that, and we cover about 100 villages through these services. And in the same area, we have a mobile clinic, we have motorbike ambulances, what all I said, all those services are there. And this is in all the tribal schools in that area, we provide regular checkup. This is the mobile medical clinics that we conduct. Daily, we go to villages. 2 villages are covered in a day by our mobile clinic. So we have such 2 mobile clinics, one in the tribal area and one in the rural area. The tribal area mobile clinic also cover 2 villages in a day, and rural also the same, morning 1 village and afternoon 1 village. Like that, the services are provided both in rural and tribal areas. Similarly, we have motorbike ambulances. All these rural and tribal health centers are provided by a motorbike ambulance service. So whenever they get a emergency case, they will go and settle the case and pick up and bring it to the health center or to any nearest center. And we also use the same motorbike ambulance as a motorbike health clinic, so that because 2 nurses, one male nurse and one female nurse, operate this motorbike health clinic. They visit the villages and provide the preventive health care services through these motorbike health clinics. And we have the Gram Arogya Bank concept, which is a very innovative, novel concept. And today we are running about 24 Gram Arogya banks, 15 in rural area and 9 in tribal areas, and covering about 35,000 population. And what we do, because what we provide in these, we provide first aid box to the local ASHA. She is trained by us through a curriculum we have developed, which is called a Arogya Mitra curriculum, and she is provided a first aid box. There is a Care Mother digital kit that we provide. That digital kit will have BP operators, glucometer, digital stethoscope, and digital thermometer, and all other mobile app. So she can run all that through her mobile app monitoring system, and also a weighing machine and other equipment that we provide, digital equipment, and also primary drugs and supplies. And there is a health library and a small lab also is provided in that Gram Arogya Bank. All these services are provided by the local trained community only. In tribal areas, of course, including the traditional healers, all the local ASHA, they provide these services. And we have, because in other villages, as 235 villages I said, even other villages also we cover through our mobile clinic, and there is a concept called healthy village. So we provide lot of workshops and micro level planning in all these villages through our postgraduate students and other research workers. We have health promoting school concept, as I told, shape school, which is implemented in 30. And in this also, all our postgraduate students and undergraduate students participate depending upon their faculty, because this program is conducted by School of Public Health, but involves all the constituent units. So whenever we go to that school, the dental postgraduate students or undergraduate students provide the oral hygiene. Similarly, the physiotherapy people provide their physical fitness and other activities. Similarly, the nursing students will provide their type of nutritional and other activities. Like that, all the constituent units team will go to that school and provide the services. And of course, all our other female health workers are provided first aid kits, and they are also provided OT testing kits, so that they can check the water treatment and other things. We also have a lot of, as I told, female sex workers. We provide maternal and child health and all other reproductive and services to these about 1,500 female sex workers, which we have been doing for last almost 19 years, almost 2005 we started. Initially it was funded by Pathfinder, now it is funded by NACO. Similarly, we have migrant workers projects. So this is how we provide the community oriented. Initially we have established an infrastructure in the community so that our undergraduate, postgraduate and research workers are placed through various internships, through various electives and through various value added programs also. We have a 30-hour value added program offered for our UG and PG students on tribal health. In that we take about tribal health and tribal issues. About 15 hours lectures will be there, which includes even the online experts deliver the lectures who are working in the tribal field, and they also are given a assignment or a project which they will complete in 15 hours so that they get a certificate in tribal health. Similarly, there is a value added certificate program of 30 hours in social responsibility and community engagement. And there is another value added program in community oriented primary care, which we are implementing from the University of Hebrew, Jerusalem, who are experts in the community oriented primary care. So which is an international certificate program that we offer. And we also conduct, actually what all I am telling, we also conduct a certificate program in social health and development, which is a 4 to 10 weeks program, mainly for international students. So from various international universities, they come in January and July batches, and they undergo this certificate program. So these are some of the community engagement activities which we feel foster the social responsibility among the students and make them socially responsible and conscious. Thank you very much.